I am Isaac Carter here with the Catalyst Effect at Dallas Startup Week, presented by DEC and sponsored by Capital One.
And I'm Fernando Labastida with the Viral Genius Framework.
And we're here with Ify and Ifani
from SP Wellness.
Yes.
That's right.
Thanks for having us.
So you are a medical doctor and you specialize in
family medicine.
In family medicine. And you have a passion for helping people live healthy lifestyles and live their best lives through, you say, causational wellness?
So my goal is to leverage obesity treatment as a means of what we call all-cause mortality.
Okay.
Essentially, anything that can decrease your lifespan or make you die sooner or make you die can be related to many things. It could be related to smoking, it could be related to being sedentary, but it can also be related to obesity. Right. So my goal is to really have that discussion addressing the quote unquote elephant in the room.
Right.
And really helping them lose weight and decrease their risk of dying and other conditions.
And so while you're passionate about the treating of the patient, you are very passionate about applying modern technology and modern approaches to kind of delivering and executing that treatment. Is that right?
That is correct. That is correct. Sorry. My background is in business, banking, et cetera, with some experience in technology building startups. And I get super excited and passionate about business in general. So it's like, how do we find ways to, improve the efficiency and the quality in the way that we deliver our solutions so that we can reach more people and achieve scale. And that way we're able to affect, more substantial outcomes.
Yeah. And I can't talk to my doctor every day, but I can talk to ChatGPT. If I have a question, you wrote your prescription already. Your patient has a doctor administered and approved treatment schedule. I don't need to talk to you every time I get a new vial of GLP-1 and wonder how much dose I should take. You already approved that dose.
Yeah.
It's week 4. So that means that now it's time for me to increase my dosage if that's the treatment plan that's been prescribed and discussed with my provider. I don't need to talk to a medical doctor again for that. We can have a portal that re-instructs them according to the care that you signed off. And if they have a question about it, hey, I don't want to take this additional dosage or something, then they could ask a question directly in that portal and you could advise them that way. So I love using technology to improve the human experience, not to eliminate it. I wouldn't ever want there to be a AI medical doctor. That's very human, needs to be very hume. You study for a long time and you know your patients.
Yeah. So that's essentially, the vision that, we've sort of identified in the sense that everyone thinks that there's this sort of like leap from, HI, which I call like human intervention, into AI. But what generally happens is when you have like cutting edge technology like that, there's a sort of a hybrid that takes place while folks are getting comfortable. You don't want to just talk to, AI in space, in just random space. You want to have some human interaction because there's places where, you need that human motivation, you need that real substance, but we don't want to get to a point where doctors are super stressed and they can't be able to see enough people because there is such a high demand for their time, right? So that's where AI can, handle, what I want to say is like FAQs, frequently asked questions, right? Autonomously to be able to address some of those things to free up her time to be able to solve, more issues for more people.
Yeah. Yeah. There has to be an education element in this. So if you look on my LinkedIn profile, you're going to see a picture from about 6 months ago of me side by side. Actually, 4 months ago. Me side by side, one at 410 pounds and one at 310 pounds. And it took me 3 years to make that difference, 2.5 years to lose 30 pounds, and then like 7 months to lose 70 pounds. And I tell people, do you remember G.I. Joe? He used to say, now you know, and knowing is half the battle. Knowing is the whole battle. The dude was wrong. What I like to say is the difference between losing 30 pounds, 10 pounds a year, and losing 70 pounds in a few months was clarity, understanding, knowing. But also I had trained a GPT, and I was able to say, hey, I'm feeling hungry today. All right, hey, here's a list of things that you can do. Drink some coffee, have another cup of tea, go for a walk, eat something that's fatty. You don't want too much protein. You don't want too much, because protein increases insulin. And one of the biggest things I learned I had to fight was insulin resistance. So I want to reduce the amount of insulin in my body. I eat 2 times a day, and if I'm hungry any other time, there's other things that I can do. And so I'm able to interact on a regular basis with this GPT. Now, it didn't have my prescribed care in there, but I don't see any reason we couldn't train it with the prescriptions, and especially GPTs do have HIPAA. So all things absolutely can be done, but you took an oath to do no harm. You do business in a way that scales, is highly ethical. So those things don't have to
Be at odds.
they don't have to be at odds at all. And that's a lot of the trick. Now, Fernando, you have a lot of experience with kind of creating a voice for people. And I think that's what a lot of people here feel like they're missing.
Yeah. And so you said something, we were talking off camera about your story. And I think that's one of the things that I wanted to get into at the moment. So what was it that spurred you to sort of take this journey in helping obese people? What was your particular light bulb moment, or your own experience, your story? Tell us about that.
Yes. So in order to tell the story that we were talking about offline, I'll go a little bit back.
Yes.
Maybe like 30 something years. So I'll start with actually my father.
Yeah.
When my father immigrated with my mom to America, they settled in Los Angeles, and he started working at Dunkin' Donuts. And you can imagine what happened from there.
You brought the extras home every day, right?
Yes, he did. And he also ate all of them as well. So he got diabetic, high cholesterol, and
Late at night.
it's not just diabetes, right? Diabetes comes with certain cousins, or certain siblings rather.
Fatty liver
high
disease.
Yes, high cholesterol, fatty liver disease, hypertension. If you see a diabetic, most likely they're having something, two or more things that are happening. So he had a good doctor that had, and this was when doctors had time to talk to their patients. So he had a good doctor that, talked to him about his lifestyle. So he went from eating lots of sweets, lots of carbohydrates, being addicted to it, to being very mindful about his activity level. He quit his job, actually. It was such a huge addiction that he was like, I can't do it.
You can't do that because he's surrounded by it, right?
Exactly, yeah. So
that was back when they still had like the fresh French crullers on the menu, right?
over 30 years ago.
I would have to quit.
All right. And they were probably like 10 cents. And so,
Oh my goodness.
Yeah. And he's from Nigeria. We don't really have things, especially not at that time.
Yeah.
And he's being introduced to a lot of flavors, a lot of preservatives that we
flour,
never,
tons of sugar.
They actually call it, when someone immigrates from Nigeria to here, they call it the Big 15. Like, you're going to at least gain 15 pounds. Taco Bell, McDonald's, Chick-fil-A, something's going to pick your fancy.
Instead of mom's home cooked meals.
Exactly.
Right.
Or instead of just walking, right? Because we walk a lot. Yeah. So he made some changes, and fast forward to now, he's in his 70s, hasn't seen a doctor outside of a colonoscopy, every 10 years.
Right.
He's living his best life. He really focused on his lifestyle, activity, eating well. Still diabetic, but he's able to manage it.
Right.
And it really, or rather, I'll also fast forward to my own journey.
Yes.
So seeing my dad, it, was always in the back of my head, like, wow, he's someone that's really nutritious, and he instilled that in us as well. But he also, at some point in time, about 20 something years ago, he moved back to Nigeria to form his business, and that kind of motivation kind of left me.
Right.
And so I was just yo-yo dieting, yo-yo waiting as well. I was in my 20s, so
I've
at
been
that
through
point,
the same thing. Yeah.
yeah. I was in my 20s. I thought I was invincible, and when you're gaining weight in the right places, and everyone's just saying, "Hey, girl, you're looking good," or you're getting noticed, and you're just like, "Well, I guess this is how it should be."
Yeah.
And so, by the time I got into medical school, I didn't really have that mindfulness in terms of or education in terms of healthy living. And so, when I got into medical school, medical school is a breeding ground for unhealthy living because
How
there's
ironic.
time. Yeah. There's no time to do anything. There's time to study. There's time to make some ramen, something that's 20 minutes maybe.
Yeah.
But you would think anyway that there's no time unless you had that type of lifestyle.
Right.
Which I didn't. And so by the time I was, I went to medical school late. So by the time I was 28, I did a routine physical, got some blood work done. I thought I was just doing a physical to satisfy some labs. I was pre-diabetic, had high cholesterol, very hypertensive at that time as
Oh my
well.
goodness.
And
What a wake-up call.
Yeah, yeah. And I was almost 200 pounds.
Right.
And like I said, it was just like, whoa, you know?
Yeah.
So I thought about the future. I understand as a medical doctor, learning about these diseases, that my risk of having these same diseases that my dad has is increased.
Right.
So I had a decision to make.
Right.
I can continue enjoying the life because I was enjoying, a little depressed, but whatever.
Yeah. Yeah.
I can continue living on with my life, or I need to start making some very difficult decisions.
Yeah.
And how could I'm literally studying the same diseases I have. So I did the latter. And I mean, it just trickled into my whole life. Like, as you're saying, Isaac, there is a transformation that goes on when you are prioritizing your health and literally just shrinking down. I didn't realize how hard my breathing was, even just walking upstairs,
Right.
or just walking a block.
Yeah.
I didn't realize that knee pain I didn't even know I thought I was living with the pain. It was
Right.
like, oh, you're in your 20s. Like, everybody sees those TikToks and
Yeah.
the Instagrams, but that's not really how we should be feeling. The backaches after 21, that's not a good idea.
Yeah. Yeah.
It shouldn't be normalized anyway.
Yeah.
We're hee and
Yeah,
it's funny,
and
but
it's so funny because the current culture says all sizes, shapes, and sizes, et cetera. But we're kind of normalizing health situations that
Yeah.
can kill us early.
Yep.
I'll tell you this.
So-
I'm living proof, and I also have patients that are silently depressed, silently worried, silently concerned. And we're all, yes, girl, and yes, queen, yes, dude, keep on. Love yourself. Not enough people are, once again, addressing the elephant in the room. Hey, gaining a little weight. I noticed that. When's the last time you had a vegetable, girl? Like something like that. I feel like if someone asked me that question on my trajectory, things would have changed, or at least I would have been at least mindful of it. But not enough people are asking that.
I just want to say something, Isaac, before you say something. I think this is the inflection point that we always get to in these interviews. There's a certain point during these interviews where, we ask the questions and the interviewees, you all, for example, give the kind of the pat answer, the one that you give to everybody. And then there's a point where we kind of get down, we peel back the layers of the onion, and we get down to the real truth of the real thing. What you just said right there is like, you go and, love yourself, et cetera. That is something that, just a little bit of advice from, marketer to you, that's the I don't know, the zeitgeist, or that's the message that you need to leverage in your marketing. Right? That could kind of set yourself apart. It's like these are the kind of things that I love to do, when I interview clients and we work on their marketing strategy, kind of getting down to that, the nitty gritty there and kind of figuring out, that is the differentiator that is going to go out and you can use that, leverage that in your marketing, for your particular target market. So anyway.
It's really interesting because it's like, it's right. People have a completely different relationship with that.
Yeah.
Where, we all know that you can have a great time, drinking, but we've gotten to a point where, when it gets to a certain point, we call it out. But when it comes to food, it literally could have the same disastrous effects.
Yeah.
Right.
But we don't have that same relationship where we're calling stuff out like, hey, maybe this is...
Yeah, maybe, you've had one, French fry too many or something or whatever. It's
And
like,
it is starting, for instance, now people are starting to say sitting is the new smoking.
Yeah.
And I know when I was 400 pounds, walking was painful. And so I remember when I tied my shoe for the first time and I didn't need to, I was able to just bend over and tie my shoe. And then, so that was like, oh my gosh, I lost a little bit of weight, but then I started hitting these milestones. I was able to sit on an airplane without the extender. And so I'm sorry that in January, when I went for my physical, I was no longer even pre-diabetic. I brought my without diet, without any
makes you
medication
so
anymore.
good.
I was my cholesterol had gone back to healthy levels, and no longer fatty liver disease. I was no longer. I had gone at that point 3 months without going into a cardiac arrhythmia.
Oh,
I wear this not because I love Apple watches, but because I run my
Sure.
ECG every day.
Yeah.
And there was a while I went, oh yeah, I only had 2 cardiac arrhythmia events today.
and that's a win.
And yeah, that's just 2. And then didn't have one this week, and now I haven't had one in 3 months. And then January is when I realized, hey, my doctor said borderline healthy. I had one thing I still need to work on. But I'm sorry, there's no better way to love yourself than to care for your body.
Yeah.
We only get one of these. And then it's not just about me. My doctor, a good friend of mine, Gabriel Huerta, a year and a half ago, he sat me down and said, listen, you have metabolic syndrome. You have fatty liver disease. You have high cholesterol. You have
Is he a
high
doctor?
sugar."
Or something?
Yeah.
Yeah.
Gabriel Huerta. He
Okay.
was on our team for a long time. He just moved on to a new opportunity. Yeah, you're dealing with acid reflux. These are all things you don't have to be dealing with.
Yeah.
You have a baby. You have a 3-year-old. You have a team of people that are counting on you. It's up to you to make sure you're there for them. And that was a wake-up call for me. And then I'm like, okay, obviously I'm working hard. I'm working out. I'm exercising. I'm trying to diet. I obviously don't know enough, and I went and bought several books and started realizing that this had to be an education thing for me. It can't just be discipline, because if it was just discipline, I was doing the work, but it wasn't working. And so then I wrote myself a GPT. I'm like, I am craving rice today. I want some rice. I'm going to eat some white rice. And the GPT said, okay, go with a brown rice, whole grain rice, and go ahead and put some rice vinegar in there. It's going to reduce your absorption of carbs by 30%. It actually tastes pretty good, especially if you're making like a stir fry or something. So I had that help there. Okay, you want to eat some carbs today. Here's a way that you can do it in a way that supports. So the application of technology, for me, 1, to increase communication and access to medical care, I love it. And 2, as an educational component. For me, obesity was and it still is to some extent, not a matter of effort. It's not like, oh, look at him, he lost a lot of weight, I know he worked real hard. It was an education thing. I needed to know how to do it. Yes, I used a compounded GLP-1 to help me control some of the urges and things like that. But then I use that in combination with other things, with low carb diet, with intermittent fasting, which has been just amazing for me. A lot of people would have a healthy lifestyle if they understood. A lot of people are like, oh yeah, look, Elon Musk used Ozempic, and like he can afford it. He's got all that money. Well, it's costing me $86 a month because I was using it basically a third of a month. So I was eating less money in food than I was spending on the GLP-1 compound.
Right.
I was saving money by doing this.
Right.
And a lot of people don't know that those options are out there, and that if you combine it, okay, you use a GLP-1 for support, and then you also do intermittent fasting or substitute some of your water for green tea, increase some of all these things that you can do and try and work around. And as long as you're capturing, for me, I want to know my arm sizes, increase or decrease, my waist, my chest, my belt line. I want to know my height to weight ratio. Obviously, I'm going to be tracking my BMI. So I have several indicators that I'm tracking, and then I can see, because it's not just the number on the scale, right? I want to track it, and I can look and see sometimes my weight stops. Oh, I dropped 2 inches off my waist.
Yeah.
And that's a good thing. My body is reorganizing. And so having that information, then access to something that can tell me maybe it's time to talk to the doctor, you've stalled out.
So that's where we want to take things technology wise, right? Where, and the technology's out there, it's available in terms of, but bringing it together is where we want to go, where you can, take a snapshot of, a mirror selfie, and it can perform the analysis like, hey, I mean, you can measure the distance between like walls when, we were getting ready to, move into our new place, and, you can measure dimensions from photos, right? So it can
Right.
tell you, hey, you're shrinking in this area. And now it can even perform analysis on, your skin context, et cetera, right? So to be able to kind of provide that holistic sense of like how you're improving, you know, not just metabolically, but physically, right? And then take it a step further to submit that information to your medical professional where they can track that data, right?
Yeah.
That changes your entire healthcare experience, where now you're really doing a lot of work in terms of prevent rather than just like reacting to stuff like, hey, what happened to me? And then even be able to like go back and track back in terms of like, what were some behaviors I exhibited over the past like 2 weeks or last month that could be causing whatever I'm feeling right now, because I have photos of like what my skin looked, or what I may have been reacting to, or what I may have been consuming, or what dosage did I take. All that information becomes your data that kind of allows for the AI to understand you as a person and your body.
I had a question about something you mentioned there. So with your product vision, right? So taking Ify's, health knowledge and then your vision for the product, does that also include like maybe automatically updating the doctor portal with your data? So like it's tracking data and you take the selfies every week or every day, et cetera. Then is that automatically kind of updating the patient portal that your doctor has access to?
Exactly, right. So the vision is for them to have a dashboard of data, right, where they can even get alerts. There's times where, my wife is getting messages from patients at like 10 p.m. at night, right? And, she has to respond to everything, and everything's a 5 a.m. alarm. But imagine if a dashboard is giving you like indicators on like what's critical.
Right.
Oh, this person is exhibiting this thing, or, you've got the wearables, right? So you're tracking information. Then there's a continuous glucose monitor. All that stuff can be like data that's embedded into a dashboard where a doctor can see issues coming on the horizon and address them with different levels of priority. So that link between the patient and the physician can happen more seamlessly, where it's like, okay, you're doing really well. Let me take some time to respond to you because I've got someone who is of more urgent need right now based on the information that I'm getting about their health and their lifestyle data.
That's awesome.
Yeah, and I would, I have a lot of experience with implementing electronic health records, and then a lot of the regulatory constraints around that. So I wouldn't want a person contributing to their health record from an app. I would want a medical professional, either somebody doing a triage or a medical professional contributing to the chart itself. But that data collected can be reviewed by the medical professional and then added to the chart when it's appropriate. In the same way that I talked to my doctor and said, I know that you prescribed this GLP-1, but I'm doing something different. And I had her give me feedback on that. Then I collect the data on that. I'm not going to prescribe my own medication. I'm not going to augment my own chart, because that chart is then used in other ways. And if a doctor hasn't been aware of what's being added there, it can throw things off.
And that's why we talk about the AI and HI hybrid model, right? So it's never going to be completely AI where you're just relying on, an automated system to kind of like, perform these functions. Well, let me not say never, maybe, depending on where technology goes, but not in the near term for sure. I know that. And that's because you still need that professional, and they have their standards that they adhere to. They have their EMRs that they use, and it'll sort of, appear as kind of like, two porters, right? You've got, the data on one side, and you've got like the qualitative and the quantitative, right? So you're looking at both and you're like, okay, I have this, right? But then I also have this new piece of information that I can look at differently, right? There's pictures, there's images, there's qualitative information that I can take and say, you've gone to the doctor where they've got, did you smoke in the last week? How many drinks have you had, right? So they have their records of you as a patient, but then there's all this stuff that they don't know, and they're relying on, whatever it is you've decided to tell them today, and they're trying to put together this information to understand how to treat you as a patient. So to be able to have both of those pieces of information, I think is going to be critical in the future.
Yeah, I think so. think so.
And to address your question about having the patient upload their own information, it's worked in the past where the patients upload their information, but then it's checked and reviewed by either associate medical director or the physician themselves, so that it stays on there.
Yeah,
Isn't just
like almost like a
discarded.
self-triage. But
Exactly.
And so gathering information is very beneficial, but that doesn't necessarily mean it means anything. So like, for example, I have had chest pains in the past. So during COVID, I played the whole stress or heart attack game. And then you go and you have the EKG done. Yeah, it's good. All right, so that pain just means, hey, get some sleep, lay off the caffeine, put the alcohol up for a little while, maybe go for a walk. That isn't the EKG results, but that's not diagnosis. I didn't have a professional at some point has to take a fact and turn it into a diagnosis or determine its value for a record. And I bought a watch. Hey, this says I'm in atrial fibrillation. Diagnosis goes on the medical chart. Now a doctor performs diagnosis. A doctor prescribes treatments of care. Perhaps that information can help understand continuums of care and patient outcomes, but also things that don't necessarily go on a chart.
And the way we think about it is, there is what exists today, and then there's also, what will exist tomorrow. And part of that is feeding the future, right?
Yeah.
So today, it's going to be very heavy on the HI, right? The human intervention. And, let's say 3 years from there, 5 years from now, you've got all this data of images, right? Of, behavior patterns that, physician or even AI can look at, and, the quality of the technology is improved, and there's more of like a robust database that isn't as speculative, right? I mean, we've seen what, AI has done, or ChatGPT or whatever, in the past 2 years, right? So think about 5 years from now, like where are they taking imaging, right?
Yeah.
And what can they glean from that? And what other sources of, data are they able to pull from to get even more critical information that can support the physician's assessment of the patient, right? So today, maybe it's, let's not prioritize this information, but tomorrow it's like, based on this new, piece of technology that's out there, it could even be, a hardware, software combination that allows the improvement of that quality. And now it's pulling from data, and now you have a bank that, allows for your health system to be better understood.
And so much of, I'm glad you said health system to improve based off of actual interaction with the patients. So much of the health industry right now has confused health insurance with health care. And as a result, so much of the doctor's interaction with the patient is related to health insurance driven questions. For example, ICD-10 listings. I literally was looking at that, and there is a ICD-10 code for sucked into jet engine second visit. First off, if you happen to get sucked into a jet engine and you get to go for a follow-up visit, you're in really good shape. But there's tens of thousands of ICD-10 codes and diagnosis codes and visit codes. And a lot of this is just put so much weight on the practitioners and on the patients. And now, all right, so there is bitten by dolphin. No joke, there's an ICD-10 code for bitten by dolphin second and third visits. I don't think that some of this focus has, if you were bitten by a dolphin or some other wildlife, like I don't necessarily think that having that level of detail increases patient outcomes. And then so much of the healthcare is dictated by patient satisfaction. Kind of like Baymax, were you satisfied with your care? And not necessarily based off of patient outcomes, patient health. And I'm hoping that technology helps us shift evidence-driven medicine to be more about the wellness and the outcome of the patient wellness, and less about administrating insurance parameters and requirements and understanding the how happy the patient is with
Yeah.
their care, but much more about how healthy are they.
Well, think about, as you brought up insurance, which is a great point you made. Think about, from an insurance perspective, terrified. I mean, everyone hates the insurance companies, but they're terrified of all types of abuse from every level. Imagine if they can pull certain data and then qualify patients like, hey, I'm much more willing to cover you because I can see images of the steps that you're taking to improve your health outcomes, right? Whether or not that data is like valid from like a diagnostic standpoint, but it shows behavior patterns that actually like helps me to prioritize you
Exactly.
for coverage
Right.
than someone who's literally like, I'm fine. And then,
And that helps them to reduce costs and help the whole medical. Yeah, exactly. It's like, ounce of prevention is something about a pound of care or something.
Ounce of prevention is worth a pound of care.
Yeah, exactly. So
I saw an article just a minute ago while I was coming back here waiting for you all, where the news was talking about how Donald Trump and RFK were blaming patients for their own chronic illnesses.
Yeah.
And I don't necessarily think that patient needs blame, but the fact is, I mean, the way my lifestyle impacted my health. And for me to come out and say, hey, dude, when Gabriel said, dude, you got to walk more, you got to eat less, you got to do these things, that's not blame as much. But the fact is, my lifestyle was contributing to events that had to be covered by health insurance. That heart surgery in Texas is not cheap and was utterly preventable. So
I wanted to ask you, what stage is your company at right now in terms of taking Ife's vision or knowledge, and her story, kind of productizing it or appifying it into a deliverable app? Are you in the ideation stage, or in the development stage, or tell us a little bit about that, and when can we expect to see something out in the market?
Yeah, so we've worked on a number of things. Initially, our program was to, treat people, right? Create an environment where folks could, lose weight, develop a healthier lifestyle, and she crushed it, right? She's killing it in that area. Essentially, now we're looking at where technology is and trying to take advantage of what's available. There's, some companies out there that have been able to kind of develop in certain areas of like, imaging your food and getting calorie count, etc. So we played a few things. And then there's tools like Lovable, for example, that allow you to build, no-code solutions. So that allows us to sort of test a number of things. So I would say more in like the testing phase. We have, some things that we've looked at and, we're testing. We've been able to sort of do the food imaging thing. But essentially, the way I'm thinking about it is I want to build something that works and that lasts, right? And right now, because, there's almost sort of a win and loss sort of cost benefit win-loss scenario with the ease of tool development allows for people to launch things really quickly, but essentially they're just sort of like gimmicks in a sense, whereas it's not really trying to solve a specific problem. It's really just trying to go viral and win people's attention. So in building something holistic, it's going to take a lot of time. And as we mentioned before, we're trying to build a collaboration tool that allows for the patient to engage with the physician in a way that they're both sharing like qualitative information and it's improving patient outcome. So that's something that takes a lot of time to kind of flesh out and figure out and
Ifani,
go through channels.
Please don't write anything that has access to PHI in Lovable.
Okay.
Yeah, unless you like fines and lawsuits and all sorts of horrendous things.
Yeah.
You're not going to be able to be HIPAA compliant in anything built on Lovable, and you have to be very, very careful with that.
I've thought about a couple of ways to sort of like manage HIPAA, but that's very good advice. Thank you.
Yeah. Awesome.
Yeah, and we'll probably discuss with you guys and see it sounds like you guys have a good grasp on like what we're trying to do and also a background in getting stuff off the ground and launch. So I can see a collaboration and kind of figuring this out.
Yeah, and I want to find out more about y'all services for myself because I feel like as though I need to lose.
Well, I wasn't going to say anything. I guess I should.
Well, the key thing, and my wife I think is the expert on this. It's not so much personally, I would like to see the stigma taken away from the whole like let's lose weight type thing, right? I think that's like a visual indicator of like maybe less healthiness, but ultimately people want to extend their lifespan and their quality of life, right? And there's so much out there. played sports my entire life. And then during the pandemic, I was sedentary and like I jumped up by like 40 pounds, right? And sure, there was like a visual indicator, but there were indicators there's insulin resistance. I'm eating like 2 times, 3 times as much as I normally eat, etc. So the way I want people to think about it is, am I exhibiting like healthy habits, right? Am I managing my eating portion, my activity level, etc.? And
this isn't about appearance. This isn't you don't look good.
Exactly.
This is about, are you healthy, and am I supporting the people in my community to have a healthy lifestyle?
Yeah.
A lifestyle where they're able to have the level of life that they want, but also be there with their family.
And what I'm terrified about is reaching the last 10 years of my life, and either living in dementia or in a wheelchair. Like I want to have a high quality last 10 years of my life, not a low quality or deteriorating quality. Last 10 years of my life.
You know what's interesting? Do you know what people are starting to call dementia now? Alzheimer's and dementia?
Diabetes of the brain.
Type 3 diabetes.
Yeah, type 3 diabetes.
Type 3 diabetes.
Yeah.
Wow.
I mean, I learned so much from my wife, honestly, in that it just blew my mind that so much of what kills you that isn't, a car accident or, a wound of some kind comes from insulin resistance and like high blood glucose level, high blood, sugar in your blood.
Cortisol.
Right.
And so most of that comes from, your nutrition.
Yeah.
Eating. So you can literally change your life just from nutrition alone, right? Absent of like an accident happened. There's so much of stroke, heart attack, dementia, like all of these things. So, I mean, I think, another point is we need to realize we've come to a point where we've like hit peak food, right? Like we were foraging for so much of human existence, and now we're
For like 99% of existence.
Yeah, now you can walk in the hallway and find a feast for free most days. Just
There's a fusion of everything. Asian.
I mean,
I know.
Well, have you ever had Mexarian? It's amazing. I had some bulgogi
sounds
beef
amazing.
tacos. Oh my gosh.
sounds good.
Look at us salivating. Exactly.
It's funny when I was first
Right.
diagnosed with type 2 diabetes, the first thing my doctor told me to do was eat small meals, several small meals, and then six times a day, small meals. Start eating when you wake up and stop eating right before you go to bed. Then I read the obesity code and I realized, oh my God, that is the worst possible thing to do. I'm going to overload my body on insulin if I want to be dependent on something. That is absolutely the worst thing to do. I was diagnosed with type 2 diabetes recently. And her doctor said that. I'm like, no, 2 meals a day, 12 o'clock, 6 o'clock, cut this back. You're going to kill yourself. And even medical doctors that specialize in treating diabetes, a lot of them don't understand that connection between the way they think, oh, hey, let's make sure your body always has some food so it can stabilize the insulin in your system. And the insulin is causing the insulin resistance.
Is causing the problem.
Which is causing the problem.
And look, I'm never gonna, profess to be, a medical professional of any kind, but
That's why you have your wife.
But to bring it back to, the point you were making, I think, that's why like your data is so important, because one thing that I've learned, in fighting in this mission is that so much of it can be, individual related, right? Like your heredity, etc. And obviously there's certain rules of thumb, and to me that sounds crazy, because if I eat in the morning, I'll just be hungrier throughout the day. So if you're eating more frequently, for me, I don't see that working. But ultimately, to be able to like track that, right, and to see how your body is responding to certain programs, there could be a variant of like human genetics that like responds better to like small incremental meals. Who knows, right? But to be able to know whether that's for you or not is to be able to have that data of like, this is what I've tried and this was how my body responded, right? And every book in medical science says it shouldn't respond this way, but here it is, right? So to be able to have that, I think, is something that's going to change the way healthcare is practiced going forward.
You know, one thing that really impresses me is when you start talking, Ifani, the love in his eyes. They just like he's just, and then when he's talking, you two partnering up in life, and then also
In
partnering
business.
up with each other's missions.
Yeah.
I think that is awesome. And also, people are looking for authenticity. They're not looking for just another app in My Fitness Pal or another Silicon Valley thing. That's not what people are looking for. They're looking for the ability to connect. I'm not looking for a product or a service. We're looking for connections. And you all have an amazing connection. I love seeing that. I love interacting with people that have that level of authenticity. And you even went and got matching hairstyles. I love it. I love it. I got to talk to my wife about that. That's going to happen.
Yeah, you and your wife should do that, man.
Well, thanks so much for being here.
Oh, this is
Yes,
fun.
We
thanks
are
for
at
it.
Dallas Startup Week. Thank you so much to the deck and inviting us out here. And Fernando, it's been a really, really interesting time here.
It really has. Thank you so much for Ifani and Iffy for your time here.
Thanks so much for having us.
Yeah.
Thanks.